This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch Wisconsin Eye on Spectrum Channels 995 and 363 and at wisi.org.
Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality. Please remain muted until it's time to ask your question. If you're on the phone and are able to do so, please use *6 to mute and unmute. Joining us for today's media briefing are Governor Tony Evers and DHS Secretary-designee Andrea. Also available to answer questions are Dr. Ryan Westergaard, the Chief Medical Officer in the DHS Bureau of Communicable Diseases, and Ryan Nilsestuen, the Chief Legal Counsel in the Office of the Governor. We'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everybody, and thanks for joining us again. I hope everyone had a safe and healthy holiday weekend. Since we last met, more than 27,000 Wisconsinites have tested positive with COVID-19. More than 1,100 Wisconsinites have been hospitalized, and 305 Wisconsinites have lost their lives. As of yesterday, DHS reported that there were more than 1,800 Wisconsinites hospitalized right now because of this virus, and nearly 1 in 4 is in an ICU. While many families were taking some time together, resting and celebrating the holiday, the virus wasn't taking a break. As we continue to move through the holiday season and winter months, we must be as vigilant as ever that we're taking every precaution to protect ourselves, our friends, families, neighbors, and fellow Wisconsinites from the spread of the virus. Staying home, practicing social distancing, and wearing a mask are not political statements. The sign to the people you pass that you care about them and their health and safety. And it's also a sign that you not only care about the people you see, but that you care about the people you don't see too. Whether it's the frontline healthcare workers, the veterans and grandparents in their nursing homes, the people in our care at our correctional institutions, or the patients in hospitals across our state fighting this virus as we speak, the best way you can help keep those folks and the people who care for them safe is by staying home, wearing a mask, and practicing social distancing. So if you choose to get together for the holiday, then we're going to need your help to help in days ahead to keep others safe. So go get tested. Symptoms could appear 14 days after exposure, but we need your help to box in the virus and stop the spread. So you can help today by isolating yourself away from others until you get your results. And remember, a negative test today does not guarantee a negative test tomorrow, and not every COVID-positive person will display symptoms. So the safest thing to do is to continue to stay home as much as you can and avoid contact with others. If you absolutely must go out, please wear a mask and maintain distance from anyone you do not live with. Folks, I don't want to oversimplify the complexity of this pandemic and the effects it has on our families, businesses, students, workers, and state. But frankly, the solutions for getting this virus under control could not be more simple. Stay home, wear a mask, maintain physical distance. Those basic actions can and will save lives when done properly and when done together. Too many Wisconsinites will celebrate this holiday season without a loved one for the first time because they lost the battle to this virus. I have a lot of hope for what the new year will bring with vaccines on the horizon. But until then, let's put our empathy, our compassion, and the health and safety of our friends and neighbors first. I'll now turn things over to Secretary-designee Andrea Palm for her update. Andrea?
Thanks, Governor. Good afternoon, everyone, and thanks for joining us again. I will start today with the numbers. So here's where things stand. We are adding 4,078 new cases to our total today, which brings us to 391,313 COVID-19 positive cases. Our hospitals are still strained. They continue to report current and imminent critical staffing shortages, and we continue to admit patients to the alternate care facility. Since yesterday, we're reporting 107 additional Wisconsinites have died from COVID-19, which brings our total to 3,420 deaths. As we keep those who have lost loved ones in our thoughts, we must recommit to doing all we can to prevent transmission and to save lives. With the current state of the pandemic, the most effective action we can take to prevent transmission is to stay home. That means limiting your interactions with people outside your household to the essential errands like shopping for groceries and picking up your prescriptions. And please remember, always wear a mask. If you hosted or attended a gathering over the long holiday weekend, please take steps to stop the spread this week by quarantining. Do not interact with people that you do not live with. If you've been exposed to COVID-19, call your healthcare provider to get a test or visit one of our community testing sites. Please quarantine and call your close contacts as you wait for results and isolate even from the people you live with if you receive a positive result. Like the governor said, a test is a snapshot in time, and a negative result means that the test did not detect COVID-19 at the time it was administered. That is why, if you've been exposed, we suggest getting a test 3 to 5 days after the exposure and not any earlier. However, due to the incubation time for COVID-19, the virus may become detectable at an even later time, which is why we recommend, if you receive a negative result, that you continue to stay home and monitor yourself for symptoms to ensure you do not develop an infection or transmit the virus to anyone else. Wisconsin is in crisis right now. It took us 7.5 months to get to our first 100,000 cases. It took us 35 days to get to 200,000 cases. By November 13th, 18 days later, we had added another 100,000 cases. Now we've reached December and are nearing 400,000 confirmed cases of COVID-19 here in Wisconsin. Our actions today will determine the numbers in the coming weeks, and we all need to do everything we can to stop the spread of COVID-19 by staying home, wearing a mask, practicing physical distancing, and washing our hands frequently. Thank you for doing your part.
Thank you. And we'll now take your questions. A reminder to maintain audio quality. Please keep phones on mute until it's time to ask your question. And we'll begin with Danny Maxwell from WKOW-TV in Madison. Danny?
Hi, this is Jennifer with WKOW, standing in for Danny. I wanted to ask about the plans for a contact tracing app. First of all, will it operate in a similar way to other states like Michigan? And also, why did it take so many months into the pandemic and into our huge surge to get this going?
So we have begun talks with Google, Apple about the app that they have developed. It is a proximity app, and we are working through details and specifics, but are excited to be able to bring to bear an additional tool for our contact tracing efforts. We anticipate deployment later this month, and certainly will keep you all posted as we work out the details and the specifics with Apple, Google, and get ready to deploy it, because obviously we will need your help to make sure as many folks in the public know about its existence, about how to use it, about how to participate with all of us in making sure our contact tracing efforts are as robust as possible.
Thank you, Jennifer. Now to Katrina Nickel from Fox 11 in Green Bay. Katrina?
Hi there, this is Katrina from Fox 11. My question is for the governor. Have you yet talked to congressional leaders about what to do when the federal CARES funding will expire at the end of the month? Have you had any recent conversations with them? Thank you.
Sure. I've submitted several letters around this issue, and I believe I've talked to a handful of the legislators personally, but my staff has been working with all the staff members of the Wisconsin delegation on a more than weekly basis, and so they know what we need, and hopefully they'll be able to bring this to some positive solution or conclusion. We absolutely need the help of the federal government. It is imperative that they step up to the plate. The present law, or the law of the CARES Act law, makes it clear that money ends on 12/31. There isn't a mechanism to jockey around that by putting that money in some secret lockbox and reopening it after the first of the year. The money's gone. So the bottom line is we need additional help from the federal government, and they're in the position to do it. Hopefully our group of legislators in Washington, D.C. will see the wisdom in that.
Thank you. Now to Taj Mahal from NBC 15 in Madison. Tajma?
Thank you for taking my question. I was wondering, I know you just said that we need additional help from federal government. What are some of the priorities for what any additional funding would be spent on first?
Yeah, continue testing and contact tracing, just as it has been all along. Public health initiatives need to make sure that we do the basics, and those two basics are making sure that we have contact tracing and robust testing. All that costs a lot of money. In addition, we would hopefully Washington, D.C. will see the value in continuing to invest in our small businesses and our farmers, and especially our rural areas of the state that have been devastated financially by this, and we could use some of the resources as we have in the CARES Act number 1 to make sure that we're helping them stay afloat. We have nowhere been close to making them whole, but at the end of the day, we want to help them stay afloat. Thirdly would be some continued help around the area of unemployment insurance. Some of the original pieces have lapsed, and we're hopeful that we can get that back in play.
Thank you, Tajma. Now to Rob Sussman from WTIQ Radio in Green Bay. Rob?
Yeah, thanks for taking my question. We're having another day of record deaths here, record reported deaths. My question for the healthcare professionals is whether or not you think that the method in which that the deaths are being reported is giving people an inaccurate picture of the current state of the virus in the state of Wisconsin. Looking at state data, it actually appears that the rate of death per day has actually been dropping steadily since November 3rd. I was wondering if that has been something that's been brought up, whether or not the method through which the state is reporting on the virus is leading people to maybe have the wrong idea about things, or whether or not this might be the best way it could possibly be done. Thank you.
Thanks, Rob. I'll let Dr. Westergaard weigh in here as well, but I think one of the things that's important to remember is in all of this data, right? Our 7-day averages help smooth reporting anomalies. We also on our website, in addition to what you see on our on our summary, which is the 107 today and the 22 yesterday and the 62 the day before, right? The daily reported number. We also have space on the website where those deaths are recorded by the date of death. So that is another way in which you can look at the data to understand what is going on here in the state of Wisconsin. That specific information comes via the county level information, so it's a little bit more granular. But I think we try with all of this data to provide a variety of ways to visualize it, a variety of ways to look at it, and then our 7-day averages so that we are smoothing, like I said, some of these bumps in daily numbers. But Dr. Westergaard, if you want to say anything more specific.
No, I don't have anything to add. That was a good description.
Thanks, Rob.
Thank you, Rob. And now to Molly Beck from the Milwaukee Journal-Sentinel. Molly?
Hi, Governor, could you tell us about your meeting with the legislative leaders today and what you talked about?
I can't because I'm meeting with them later this afternoon. But what I hope to talk with them about, and will be, is seeing if they have any more questions about the pieces of legislation or the legislation that we proposed and the different parts. If they have, if they've determined that they can support some of them or not support some of them, and also it's real important. They indicated to me last week or 2 weeks ago when we met that they may have some further ideas that they would like to propose themselves, and so those are the questions I'll be asking. And the other question I'll be asking is if indeed there are some pieces of legislation that we can all, or pieces of the puzzle that we can all agree on, are they willing to come into session sometime in December, or middle of December, hopefully.
Thank you, Molly. Now to Scott Bauer from the Associated Press. Scott?
Hi, thanks for doing this. Governor, do you have any reaction to the lawsuit filed today by the Trump campaign seeking to disqualify a couple 100,000 ballots in Dane and Milwaukee counties?
Yeah, and first of all, I just have to say how, as governor, how proud I am of the volunteers, the clerks, the other folks that were working at the polls and did all the work during the recount, and frankly, the voters of the state of Wisconsin. We had a great turnout. It was fair and very free, accurate, and I think everybody did whatever they could to make sure that they weren't transmitting the virus at the same time. But at the end of the day, numbers don't lie, and I personally carried out my duty to certify that election, and following the law, and frankly, following procedures that were done 4 years ago that amazingly no one had problems with. This time they do. But the bottom line is, to answer your specific question, I believe that the lawsuit filed by the President of the United States has no merit.
Thank you, Scott. Now to Mason Dowling from WAOW-TV in Wausau. Mason? Mason Dowling? A reminder, *6 to unmute your phone. And we'll move on then to Stephanie Hoff from West Politics. Stephanie?
Hello, and thanks for taking my call today. My question is for the governor. So with a $1.2 billion surplus projected for this fiscal year, can the state afford its own stimulus package? Well,
we have to make sure that we know exactly where we are at the end of the day. So I think it's premature to say that we're having any type of package, because we've done lots of cutting, as you likely know, $300 million, and So no, I don't think that $1.2 billion that you mentioned is something that we can just say, yes, let's do it ourselves. Frankly, and most importantly, this is a federal issue. This is not a state issue. The virus is not just happening in Wisconsin, it's happening in other states, and we believe that as a result of that, just like before, there's no change there, is that it is a national pandemic, and we need a national response, and that includes money in order to contact trace and do the public health things that we need to do around testing.
Thank you, Stephanie. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah, thank you very much for the call today. You mentioned that the hope is that the legislature convenes yet this month on COVID-19 legislation. Some have kind of estimated that may not happen until maybe early next year. I'm just kind of curious from your perspective, or even from public health officials' perspective, what's the difference of that kind of month? I mean, how significant do you feel it is that action were to take place sooner rather than later? Thank you.
Well, I can just say if there's not enough money, and and the federal money ends on 12/31, we cannot afford to have any lapse in testing and contact tracing or any of the other things we do around public health. Taking a vacation from doing what we know we need to do, and at the same time kind of ramping up the vaccination efforts. That would be probably the dumbest thing we could think of doing. We need a consistent public health presence throughout the rest of this calendar year and into the next one.
Thank you, Mitchell. Now to Victor Jacobo from CBS 58 in Milwaukee. Victor?
Hello, good afternoon. Thank you for taking the call again. Just wanted to ask, as there have been, a lot of dates thrown out for a potential vaccine rollout, and I know in previous availabilities, there's been, the consensus that healthcare workers should be first to receive it. I'm wondering whether the governor or the health experts can kind of give an accurate picture of when, that first set of healthcare workers are expected to receive those vaccines, and if there are any other additional details about, who may be next and what that timeline may look like. Thank you.
Yeah, thanks, Victor. I think while we are all very anxiously awaiting a vaccine, I think we do need to remember that first and foremost, the FDA has to find the two applications that they now have in their possession, one from Pfizer, one from Moderna, that those applications provide enough data for them to feel comfortable to approve either under emergency use authorization or full approval the use of those vaccines. Anticipating that does happen, we do expect to have a small amount of vaccine in the state of Wisconsin by the end of the year. And as you suggest, it seems like while we're waiting on final recommendations from the Advisory Committee on Immunization Practices, which is a federal advisory committee, and the CDC for how we think about prioritization, we certainly do anticipate, as you suggest, that healthcare workers will be at the top of that list. And so we continue our planning. We actually are in very close contact, as are all states, with the CDC and with our federal partners, so that as they have additional information or things shift and change, that they're able to provide that to us as quickly as possible, and we in turn will be able to shift and change here on the ground in our planning and our efforts moving forward. So we anticipate we did right before Thanksgiving a briefing specifically on vaccinations and the status of things with you all. We anticipate doing more of those, and so as we get enough information to make it something that is a worthwhile way to spend 45 minutes of your time, we will certainly schedule more of those.
Thank you, Victor. Now to Madeline Anderson from Fox 6 in Milwaukee. Madeline?
Hi, my question is, yesterday we learned that a high school student from Madison had died of COVID-19 complications over the Thanksgiving weekend, and I saw that this person's death is not reflected on the DHS website. So first of all, I'm just wondering, what are your thoughts on a young person, a teenager, dying from COVID potentially, and it could be the youngest person in the state if confirmed, and then what is DHS role in determining if, in fact, this death is a confirmed result of COVID?
Well, as you suggest, it would be a first for us, and obviously, the death of a young person from COVID or anything else is a significant tragedy, and I know that his family, the high school, that whole community is grappling with what happened over the holiday weekend. As it relates to the reporting of that death, I'll let Dr. Westergaard dig into the details of it, but to your point, we have not yet at DHS received a report of an adolescent death due to COVID-19. That it may be with the medical examiner, maybe with the healthcare provider, but as that information, if that is what it is deemed to have been the cause, that will come up through the process, up through the local public health agency to DHS, and will be reflected on the website. But Dr. Westergaard, you may want to dig in.
It's a good response. The reason that there's sometimes a lag of a couple of days with the death reported data is that our role at DHS is not to determine the cause of death. That happens either by the medical team that's caring for a patient if they're in the hospital, or a medical examiner or coroner if someone passes away outside the hospital. So that death certificate is the piece that we use in terms of reporting and collecting data on causes of death, and that can take several days. So we don't reflect any causes of death or count them as deaths in our data until we receive that death certificate, and that can take a few days.
Thank you, Madeline. Now to Mary Jo Ola from TMJ4 in Milwaukee. Mary Jo.
Hi, thanks so much for your time. Just kind of jumping off the vaccine theme that I know another reporter asked about. We've learned that a shipment of the Pfizer COVID-19 vaccines came through O'Hare yesterday and should be stored at their facility in Pleasant Prairie. Since DHS is kind of determining the policies for distribution in the state, what can you tell us about the number of doses that should be there now? And since this is one of two in the country, kind of what distribution looks like. Is that all going to be for Wisconsin? Is that going to be like split up between surrounding states?
Yeah, so I think the Pleasant Prairie location you're talking about is actually a Pfizer operation. We, like every other state, will receive our allocation based on our population, our population relative to populations of other states, so that everybody is getting their fair share, as things roll off the manufacturing line. So, and we here in Wisconsin are working with a number of what we are calling hubs around the state. They are predominantly folks who have access to the deep freeze that is necessary for storage of the Pfizer vaccine, and then will further distribute from those locations out to other parts of the state. Again, depending on how many doses are coming off the manufacturing line, what our allocation of that is, what the priorities are, and the cascade from there. So as we learn more about what our initial allocations will be, the timing of their arrival, we will subsequently push those out across the state, and they'll be utilized in the priority of populations as determined by ACIP, and then in consultation with our advisory committee here in the state moving forward.
Thank you, Mary Jo. Now to Denise Lockwood from Racine County I. Denise.
Yeah, my question is regarding the proactive weekly testing. According to the White House's task force, that's a significant area that they want to see expanded. What is kind of the state's strategy around point of care antigen testing and being more proactive in getting it into a lot more the hands of more people?
It's a great question. The supply of antigen testing is currently controlled by the federal government. We have received a number of supplies that went to to skilled nursing facilities. We received some at the state level, which we pushed to hospitals. But we agree and have worked throughout the pandemic, obviously, to expand our testing capacity, to expand the diversity of tests so that we could deal with supply chain issues, but also recognizing that antigen tests are, while they are less accurate, they are more rapid, and so there is a place and a strength in that kind of testing if used in the right settings and the right ways. So we're anxiously awaiting an opportunity to be able to get more antigen testing to deal into our broader testing strategy while we continue to build capacity for the PCR tests and the partnerships we have with labs here in Wisconsin to make sure we have adequate testing more broadly for people who need testing.
Thank you, Denise. Now to Shemaine Mills from Wisconsin Public Radio. Shemaine.
Good afternoon. I'm wondering how hospitals are implementing crisis standards of care. Thank you.
Shemaine, could you repeat your question, please?
I'm wondering how close Wisconsin hospitals are to implementing crisis standards of care.
Crisis standards of care is a broad term that encompasses a lot of practices that we wouldn't necessarily consider to be ideal or safe outside of a crisis. So it's not one thing. I would say the most the area which most hospitals have moved into doing in that regard that we would consider a crisis standard is the idea of having healthcare employees, healthcare providers who have been exposed at their work at home have had come back to work during their quarantine period. So that's something that under normal circumstances we wouldn't do. In the setting of a staffing crisis where hospital leadership feels it's safer or it's more dangerous for patients to keep people home than to have healthcare workers come back to the workplace, that's a standard. And we've given guidance on how to do that in a way that is more safely by doing aggressive symptom monitoring, enhanced personal protective equipment in a regimen of serial testing, so they get tested every 3 days. So that's one example, and I would say, I don't have a precise number, but we've heard of quite a few hospitals that have had to do something like that, which reflects the fact that they are operating under crisis standards. There's a large range of other things that I think are on the table that we haven't had. But I would say the short answer is that many, perhaps most hospitals have had to move into that space where, at least in the setting of having healthcare workers work during their quarantine period, that they've had to do that because of the staffing shortages.
Thank you, Shemaine. Now to Sean Kirkby from Wisconsin Health News. Sean.
Hi, thank you for holding this. I know that there's a few new COVID-19 treatments that came out last month, including, I'll probably butcher his name, but Bomlanivimab, which I believe the state has received some shipments of that. Can you talk about how the states distributed that and what impact it's having? Can any decline in hospitalizations be attributed to that? Thank you.
So I can take that one as well. So there's been 2 new products in the family of monoclonal antibodies. So these are synthetic antibodies that are administered through an IV. And they have not received FDA approval as an approved drug, but they received emergency use authorization because preliminary data suggested that they might be useful. And in those studies, they were useful for reducing the probability of hospitalization among people who got the active drug compared to placebo. So the federal government procured large numbers of all of these products and are delivering them to states. And we've used similar mechanisms that we used earlier in the pandemic with a drug called remdesivir to deliver shipments of this product to hospitals. The monoclonal antibodies are somewhat unique and challenging because they need to be given through an IV, but also not to hospitalized patients, but patients who are in an outpatient setting. So for the past 2 weeks, we've been distributing the medicine to hospitals, and they've been having to come up with new logistical arrangements to try to infuse the medication either in emergency departments or outpatient infusion centers. When I last checked, most of the hospitals had started to treat these, but it's relatively small numbers. I think it'd be unlikely that this would have a population-level impact given the small numbers of doses, but it's a potentially useful tool that we'll take anything we can get that may be beneficial for patients. So we're supporting its use in every way that we can.
Thank you, Sean. Now to Eric Gunn from Wisconsin Examiner. Eric?
Thank you very much for taking my question. I believe this is for Governor Evers. Wisconsin prisons continue to be over capacity, which of course increases the risk for COVID-19 transmission, as has been evidenced by recent outbreaks. Today it was announced that Waupun is to close one cell corridor, which will send 220 prisoners elsewhere to facilities that presumably are already overcrowded. So my question is in a couple parts. Is it time to consider some form of compassionate release to reduce crowding and risk to prisoners? And if it's not, why not? Or is the virus just so prevalent among the incarcerated that it's really too late to take that step? That's my question. Thank you very much.
Well, several questions there, but the answer to that last question is clear, is that when you have community spread, even though people are incarcerated, they're impacted by the people that work there and other ways of transmitting the disease. So it's not something that I think is endemic to the correctional institutions and the people in our care. That said, we absolutely try everything we can to keep the virus from spreading to our prison population. And that goes back to the things we've all talked about a gazillion times. It's masking, it's physical distancing, it's making sure that you're not hanging out in small places with lots of other people that aren't wearing a mask. All those things are going to help the people in our care. That said, our prison population actually has decreased during the pandemic for various types of programs that we feel it's clear that it's helpful. But at the end of the day, if we were to make our prisons, we could release half of the prisoners, and if we still have community spread, it would still be getting into the prison. And so this is. Yes, I absolutely believe that we need to have criminal justice reform in the state and reduce the number of people entering the system, helping the people that exit the system in a better way. There's all sorts of things we can do long term, which we will be more than interested in doing. We have been in the past before the pandemic. But at the end of the day, whether it's nursing home or whether it's correctional institutions or places where people are permanently stationed, for lack of a better term, it's the issue of what's going on in the community and the state of Wisconsin and our country that this virus is so prevalent. We have to break that cycle. Or if we had 5% of the prisoners left in an institution, they'd still be getting COVID-19. We have to do our job outside of these institutions.
Thank you, Eric. Now to Brittany Schmidt from WBAY-TV in Green Bay. Brittany?
Hi, this is Katie Anderson filling in for Brittany. I just had a question. If there is a push at the state level to get people who have recovered from COVID-19 to donate plasma, as this has been linked to better recovery times for some of those who have COVID-19 right now? Thanks.
So we're not actively encouraging it. That is happening in the community. There's some organizations that are collecting plasma. There's not an FDA-approved treatment regimen that involves convalescent plasma. The U.S. National COVID-19 Treatment Panel says there's not enough evidence to recommend for or against it, which isn't to say that it's not beneficial, but it's not a standard treatment. So we are, there's more research and experience accumulating, but we're not actively encouraging that at this time.
Thank you, Katie. Now to Amanda Quintana from News 3 Now in Madison. Amanda. Amanda Quintana. Okay, moving on then to Kent Wayne Scott from WISN TV in Milwaukee. Kent?
Hi, thanks. Just a question for Secretary Palm. You mentioned thinking about prioritization once the vaccine becomes available. I'm wondering your thoughts about the rollout and any sort of infrastructure required once it becomes more readily available to the general public. Will it just be through physicians and pharmacies, or will we have large drive-through sites similar to the test sites that we have now? What's your vision for how this is going to roll out?
Yeah, I appreciate the question. I think we're thinking about this in a number of ways, and we've learned a lot of lessons by standing up and expanding testing across the state, and so we think sort of the more the merrier. And in terms of that, if you're talking about frontline healthcare workers as a top priority, partnering with healthcare providers, partnering with hospital systems to help distribute, to get those shots in the arms of their workers is a natural partnership for us. It's a natural extension of the work we have been doing with healthcare providers and hospitals throughout this pandemic. We opted into a program that the federal government stood up with pharmacies around the country, and pharmacies have agreed to partner with skilled nursing facilities to go on site to those facilities and provide vaccination to those populations when and where their turn in the priority list comes. So we are going to take advantage of that partnership. And we anticipate, much like the distribution of flu vaccine, that pharmacies will continue to be partners outside of the skilled nursing setting, that many of them will want to be able to provide COVID-19 vaccine on-site in pharmacies, so that they are able to be a community resource for folks once we get to a place where it's really readily available to the general public. We also certainly are thinking about, like we have established mobile testing sites or drive-through testing sites, that is a tool that we have developed and over time made more efficient, and we certainly are looking at that model again when we are in a place where vaccine is really readily available, and you would want to have those kind of community access points for large numbers of the population. So we're thinking about this in a variety of ways, wanting to be creative, wanting to make sure, because this is a challenge when you're thinking about the number of vaccines that you're going to want to put in arms in as short a period of time as you can, as safely as you can. So we're anxious to have new partners if that's necessary, but do want to make sure we build on what we have learned already in this pandemic to build and drive public health infrastructure in ways that help us deliver vaccine as quickly as possible.
Thank you, Kent. Now to Sophie Carson from USA Today Network, Wisconsin. Sophie? Sophie Carson? Hello. Go ahead.
Hi, I'm sorry about that. I clicked *6, but thank you for taking my call. What, if anything, can we draw from the declining 7-day average since mid-November, and what can we see in the coming weeks? What do you see in the coming weeks?
So I'll say a couple things, Sophie, and then Dr. Westergaard can weigh in as well. I think, right, we have, as you suggest, seen a decline in our 7-day positivity rate. I think any decline in our numbers, we've also seen a slight decline in hospitalizations. I think we need to take a wait and see. We certainly saw less demand for testing over the long holiday weekend, and we had fewer community testing sites available over the weekend. So I think we need to hold a little bit, see how the numbers reveal themselves to us over the coming couple of weeks. But I am hopeful that there is something real there in that decline, and that we, as Wisconsinites, continue to double down, continue to do the work that is necessary to reduce the spread of the disease. We've got, even at a reduced, 7-day average, what is like 4,200, 4,300 new daily cases is the 7-day average. That is still way, way, way too high. I remember the days when we started breaching 1,000, and we were alarmed by that, and now we're glad when we're at 4,200. We sort of have gotten used to a cadence that is way too high. And while I hope we are going in the right direction, it is in no way a sign that we need to take our foot off the gas, because we have a long way to go to get back to a place where our daily cases are manageable, right? From a testing perspective, from a contact tracing perspective, from a hospitalization perspective. There are so many deaths that we can and should prevent by doing everything that we can to stop the spread. So I want to be hopeful, but I think we need to be realistic. We need to wait and see how the numbers shake out here over the next couple of weeks, and we need to double down and do more to reduce our numbers even further.
I agree. I'd say the one piece that I think still is a sign that it's a really dangerous situation is it's a really high % positive test. So we really, our standard of wanting to see that less than 5%, or ideally less than 1%, as a marker of we're testing enough people and we have a good handle on transmission. We're far, far above that. So I think it's measured good news. If there were two possibilities backing up 2 weeks where it would continue to climb or level off as it has, clearly it's better than what we're experiencing here. But we can't really call it good news in the sense that we can work any less hard. In fact, we still need to work harder because there's still a lot of undiagnosed infection out there. Transmission is still occurring at a high level, and we really need to do more, not less, to try to prevent the spread further.
Thank you, Sophie. Now to Jonathan Nizer from NBC 26 in Green Bay. Jonathan?
Yes, thank you for taking the question. My question that I was going in with just got answered, so I'll throw a new one out there that we've been kind of tossing around amongst our newsroom. We're curious, at the beginning of the pandemic, there were locations in some communities, like hotels and such, where people could go and quarantine away from their family units and such. Are such facilities still available for people who need them now, or has that kind of gone away?
Yeah, safe isolation and quarantine is absolutely still a thing, right? Household transmission, a positive case in a household that can't safely isolate from the rest of the family leads to transmission among those family members, and that's part of the chain we want to break. And so people being able to safely isolate and quarantine is a really important part of what we are doing and need to do. And some of those facilities I assume you're talking about were ones that we invested in at the state level, which have been decommissioned, but our local public health and county partners are still accommodating safe isolation and quarantine. They are using some of their CARES Act dollars to make sure that people have access when they need it to safe isolation and quarantine. But it is fundamentally a piece of this that continues to need to happen. It's why we talked about it in our opening remarks, that people need the space to isolate and quarantine in a way to break transmission, not to transmit to family members and other people that they live with. I don't know, Dr. Westergaard, if you want to say more about that.
It's a resource that would be put to good use wherever possible. There's so many cases. There's so many households where cases are. It may not be sufficient, but any means we can do to support people isolating and quarantining safely out of their household would be better, because household transmission is one of the greatest risks. It's probably higher than 50% risk of one person having an infection in their household that, within a week, 50% risk that another person in the household will be infected. So it's a very high risk, and it's a great point that it needs to be part of our strategy.
Thank you, Jonathan. And our final question this afternoon belongs to Angelina Mosher Salazar from Milwaukee Public Radio. Angelina?
Hi, good afternoon. So we know that nursing homes have been fatally hit by the coronavirus. So as the vaccine becomes available, what is the plan for residents of long-term care facilities? And I'm thinking specifically residents or staff who don't want to take the vaccine. Will private facilities mandate their staff, or will the state roll out any information campaigns to target this population? Thank you.
Yeah, I mean, you're absolutely right that throughout this pandemic, our nursing home and skilled nursing facility residents have been an absolute priority for us. And we continue, whether it's on the testing front, whether it's on infection control, whether it's on staffing shortages, to be close partners with skilled nursing to try to reduce the spread, infection, illness, and death as much as possible. As it relates to the vaccine, as I mentioned, we as a state have opted into a program whereby pharmacies have agreed to partner with skilled nursing facilities to go on site at those facilities and provide vaccine when it is available. Obviously, we are awaiting approval of a vaccine. We are awaiting, subsequent to that, recommendations from the Advisory Committee on Immunization Practices and understanding what the cadence and frequency of delivery of vaccine and in what numbers we will see here in the state of Wisconsin. So we are grateful for this partnership with pharmacies. Almost all of our almost all of our skilled nursing facilities have indicated that they want to participate in the program with us and with our pharmacy partners. So we anticipate good uptick of the vaccine among this population, but they will continue to be a focus for us. And as we understand more of the details about when and how much and at what cadence we'll be receiving vaccine, we'll be able to dig in on the specifics more easily with you.
Thank you, Angelina. And that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a good afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.